right over the wound. I recommend like tucking it in or taping it down so it doesn't move on you. So, you know, when you're doing the ultrasound, it doesn't go all over the place. It's up to you guys, okay? Just make sure if you have ultrasound on your practical, make sure you have all the tools in there before you get started, just so you're not going in and out and whatnot, okay? So, turning this guy on, there's a back switch, okay? It's plugged in, so make sure you get the back switch turned on, okay? So, this side over here is E-stem, this side is ultrasound, okay? So we touch this guy, and it's already on continuous, so we're okay with that, right? And it's on 1, but otherwise we can change it this way by just pressing on this guy, right? All right, and what about my intensity?
Patient specific.
Not the same as, yeah, it's not the same as like our musculoskeletal situation, right? Right, it's
Your parameter is like 1.5 centimeters squared.
for both, yeah.
Watts per centimeter squared, but you might not go up that high. For continuous, you may, it depends on where you're doing it. For continuous, you may wind up only doing 0.6, 0.7, 0.8, depending on where you are on the body.
The protocols say 1.5. So like it says, patient specific. Patients should not feel any, like if they feel a little bit of warmth with the continuous, that's okay, but I do not want it to burn them. I don't want to do that stuff. So when you're getting set up, you can explain, this is what we're doing. This is to increase your wound healing, to get it started again while you're setting it up. Now, so we got the 5 minutes, right? Make sure you're only, how many sound heads should I go outside first treating? Like 1 to 2, right? So I want to go, I'm not going to just stay right in that area. I'm going to go around and treat that area. I get 1 to 2 or 1 to 3. Yeah, so just this tiny little area. You're going to treat that area first. If it's a big wound, you're going to move to the next one after that. Sound good?
And make sure that you, in your history, when you're taking a history of your patient, that you find out whether or not there's some areas of desensitization, right? So, do they have sensation issues in the area around the wound? Do they have numbness? Do they have tingling? Because that's going to give you an indication of how much they're going to actually be able to tolerate. And they could be telling you, I don't feel anything, but you could be burning them. So you want to make sure you maintain within the parameters that are set for that treatment.
Yeah.
Sorry, you said like normally 1.5, but if it's like a place where it's like close to bone, is that when you would go down to like 0.8?
You might.
Might, yeah.
When you're using continuous, if they feel a little bit of heat, that's fine, but like she said, you don't want them to get burned. But people that have sensation issues won't know if they're getting burned, right? So it's up to us as practitioners to set those parameters.
And just make sure you're always moving it. Don't just stay, especially with continuous, just don't stay in a certain area because it will get hot. Who should not get ultrasound? What are contraindications?
You have peripheral neuropathy.
That's going to affect it. It's probably more of a precaution. Okay. So, what's that? Cancer, why? Right, increasing metastasis, right? That's definitely contraindication. What else?
Pacemaker.
Osteomyelitis is also, you're the first person who brought it up, but you don't want to spread that infection anywhere.
Right.
Pacemaker. What if I have a wound on the foot and have a pacemaker? I'm okay. E-stem, you just don't want to be in this area, right? With the pacemaker. What about pregnancy too? They can have it on the, but you just cannot be, just be more of a precaution. You can't do an ultrasound on the stomach if someone's pregnant or something like that, right?
What if you have a blood clot? You're going to do some ultrasound, continuous ultrasound over that?
No.
Why not? Good move. You don't want that
There's
to
not
happen.
great evidence on that, but it's more of like, if someone has a DVT, they're safe than sorry, right? Anything else you guys can think of?
Carotid sinus?
What was that?
Carotid sinus?
That's a different one.
I have to look that one up. It's not anything that I've heard of before, but I mean, That's like if you're like pressing on I'm trying to think, carotids are located in aortic arch. Is that what you're talking about? Yeah, neck stuff is like going over arteries. I would not do it. Genitals is a contraindication as well. And unfortunately, you guys are going to see quite a bit of, fair amount of people with wounds on their scrotum and their test. It's especially patients who are slide board transfers. It's an area that gets really broken down for patients. Okay. I think we got all the precautions and
Metal implants.
What was that?
Metal implants.
Yeah.
Yep. Yes. You're not
Another
going to be. Yep.
Another one we talked about was, what if you have a broken bone? You have a fracture. You're gonna do an ultrasound on it?
No.
You can find out on yourself, but don't do it on your patient.
I've done it. I did it on a